An emergency meeting is underway right now in Cape Coral, the city trying to decide whether to mandate masks. And already people are being taken away in handcuffs.
Breaking news at 6, the 17-year-old Fort Myers girl who died of coronavirus was with 100 other children just days before her death.
Naples Community Hospital unveils its new pandemic plan after the number of patients nearly doubles in recent weeks.
I'm lucky I have my parents right now to help out, because if they weren't in that position, I would be homeless right now.
Targeting the vulnerable, people out of a job have lost thousands to a scheme to steal unemployment money.
Experts say contact tracing is the only way we can get back to some kind of normalcy, but has Florida passed the point of no return?
Happening right now, Cape Coral city leaders are meeting about a mask mandate. You are looking live at the meeting, and it has been intense from the start.
I don't envy you guys. This is clearly a very passionate and emotional subject for a lot of people. If we can't come up with a greatest good for all people plan, let's try for a least harm plan.
Thank you for watching NBC2. I'm Peter Bush.
And I'm Kelly Burns. 3 people were arrested outside City Council chambers for not wearing masks to the meeting. NBC2's Christina Mendez is in the Cape live right now, where the heated debate continues after council failed to vote at a meeting last week.
Yeah, Kelly, that discussion is still happening right now, and I can tell you that there is an overwhelming response to not pass this mandate. If you take a look here underneath this building, that's kind of the overflow area, because the inside has filled up for social distancing purposes, and they are allowing those people to go upstairs one by one to give their opinion on what they want to see. But again, most people here are really putting their foot down, asking council to be against mandating masks in certain circumstances here in the city.
Before the meeting started, 2 women and a man were arrested for resisting. They weren't wearing a mask, which is mandatory to attend the discussion. Back inside,
you can all be unseated if you choose to mandate these masks.
We are losing the epidemic status. We're losing it.
I care about people. That is the type of person I am, and that I will always be.
While most speakers are against a mask mandate, some businesses who would be directly impacted by this are on a different page.
I think it's going to be good for the people, and it's going to be good for the restaurant. Other than that, we will be closed if we continue to drop like that, and we don't want it closed.
From serving up food to sermons.
In Jesus' name we pray. Amen.
Cape Coral Community Church planned to open indoor services last Sunday, but the surge in coronavirus cases is keeping worship drive-up style and online for now.
The opportunity for coronavirus to spread from person to person is just too high.
A city mask mandate or not.
Really, the heart of it for me is, do you care enough about our society and people you don't even know to wear a mask to bring this thing under control? And it seems like a small inconvenience.
Pastor David Rigby says parishioners will be asked to wear one once indoor services resume.
We can just say, hey guys, love your neighbor and wear a mask.
The discussion is still happening right now, and so many neighbors came to speak today that council actually had to limit those people to 2 minutes versus 3. You can count on NBC2 to be here through the night, letting you know what's happening inside. Reporting live in Cape Coral, Christina Mendez, NBC2.
Punta Gorda will talk about a mask mandate Wednesday morning at 9. Count on NBC2 to be there. And the mayor of Fort Myers tells us city leaders will meet this week also to discuss that mask requirement.
We want to give you a better perspective about how fast the number of COVID cases is rising in Florida. Today, our state has 206,000 confirmed cases. That's the 3rd most in the country, behind California, which has 271,000, and New York, which has over 400,000 cases. What's really alarming, though, is the speed of the recent surge. We have graphed out all the cases in our state since March 7th. That's the first day a death was reported in Lee County. Now, I'll show you. The blue bar shows how long it took to get from 0 cases to 100,000 cases. It took from March 7th to June 22nd, 3.5 months. The red bars we're about to show you shows us how long it took to get from 100,000 to 200,000 cases. It took less than 2 weeks. This is textbook exponential growth. And it's not just that we're doing more testing. The percentage of people testing positive has tripled over the past few weeks.
Southwest Florida is seeing more cases than other parts of the country as well. Lee County alone has over 7,500 COVID cases confirmed. That's more than any of these 10 states. Remember, more in a single county than an entire state. Lee, Collier, Hendley, Charlotte, Glades, and DeSoto counties combined have a total of more than 15,000 coronavirus cases. And that means Southwest Florida has more cases than any of these 14 states.
This is something we all need to remember. Flattening the curve is not about reducing the number of cases or making fewer people sick. It's about making sure our hospitals don't get overwhelmed. Lee Health is trying to get ahead of that game by texting nurses and doctors to see if they're available to help out. We talked to a doctor from Lee Health today who says most of his patients aren't actually sick with COVID-19. He says a lot of people were too worried to come to the hospital because of the virus, and they got sicker by staying at home.
Definitely want to get out there that if you need medical attention requiring an ER or an ICU, don't delay.
It takes everyone. The big Lee system and the small Lehigh Regional, we all have to work together to take care of it.
There are just over 60 open ICU beds in our 6 Southwest Florida counties. Doctors also say they're seeing a trend of younger people, ages 20 to 40, having to go into the ICU. There's some breaking news at 6 about one of the youngest people in our state to die from the coronavirus.
According to a medical examiner's report, Carson Davis had attended a church function with 100 other children just days before she got sick. NBC2 investigator Evan Dean is in the newsroom.
And Peter and Kelly, the ME's report shows what happened in the 2 weeks leading up to Carson's tragic death. It shows her parents' attempts to treat her, including the medicines they used. It also shows where she may have gotten the virus, a youth church event with 100 other kids in attendance.
From messages on a GoFundMe page to the official ME report, it is clear Carson Davis was a fighter, not just in her final days, but throughout her short life. She battled a number of health issues from an early age, including cancer and a rare autoimmune disorder. But it was last month when her battle with coronavirus began. The Miami-Dade County Medical Examiner's Office says it was June 10th when Carson attended a church function. We've confirmed it was here at the First Assembly of God's Youth Church in Fort Myers. The ME reported Carson was with 100 other kids, did not wear a mask, and social distancing was not followed. From June 10th through the 15th, the report says Carson's mother, a nurse, and her stepfather, a physician's assistant, treated her with azithromycin, an antibiotic. But on the 13th, she developed symptoms, a headache, sinus pressure, and a mild cough. The report says her family thought she'd had a sinus infection. The symptoms persisted, and on June 19th, the report says Carson's mother noted she looked gray while sleeping. Her mother discovered Carson's oxygen levels were low and gave her some of her grandfather's oxygen. The report says her parents also gave Carson hydroxychloroquine, which that same month was revoked for emergency use by the FDA after it was touted earlier on in the pandemic. Carson was then admitted to the pediatric ICU at Golisano, and she tested positive for coronavirus. The report says her parents declined intubation. On June 20th and the 21st, she was given plasma therapy. A day later, on the 22nd, she was intubated, but problems persisted. Carson was taken to a children's hospital in Miami for more extreme measures. But ultimately, on the afternoon of June 23rd, she was pronounced dead at just 17. We spoke with a pastor today at First Assembly of God. He says contrary to the report, the church did take precautions to keep kids safe during that June 10th event. But he said if kids weren't practicing social distancing, that was on them. He says the church wasn't going to be policing the event. We tried asking some more follow-up questions, but we are still waiting to hear back.
We also stopped by the Davis home today to talk about that report, but we were asked to leave when we got there. Live in the newsroom, I'm Evan Dean for NBC2.
In Collier County, there's a new pandemic plan at NCH. Hospitalizations have nearly doubled in the past month. That has officials lining up ventilators and getting teams of nurses and doctors on standby. NBC2's Jennifer Veglas gives us a look at how the hospital is handling the surge.
There are over 5,000 cases of COVID-19 in Collier County. Compare that to last Thursday. We have over 500, there are approximately 4,500 cases. This is a 500 count increase in cases in less than a week.
As overall positive cases in Collier rise, so does the slope of this chart depicting hospitalizations for COVID at NCH. That's why NCH is ramping up preparations for when the peak of this pandemic reaches Collier, reserving 153 ventilators and holding 100 nurses and 100 physicians on standby. But they say there is an upside. As of last week, only 6 of these 153 ventilators are being used, and only 99 of their 715 COVID-19 hospital beds are being used. Still, the DOH says the fight to flatten the curve must continue.
Wearing a mask, something that covers your nose and your mouth at all times, this helps stop that droplet transmission. But the point of those mitigation efforts is to flatten that curve so that we don't overtax our health facilities, our hospitals, and your health department.
There was Jennifer Veglas reporting. NCH is in urgent need for plasma for people with COVID-19. So if you have fully recovered from the virus for at least 2 weeks, you can donate blood. For more information, go to the NBC2 News app.
Now that our numbers have grown exponentially, it becomes that much more difficult to be able to effectively do contact tracing.
Why experts say it's especially tough to trace the virus in Florida. Next.